ahead and start the event. Good evening, everyone. Thank you for joining us again tonight to continue our conversation from a few weeks ago. We do value your time and your interest in these topics of testing, vaccines, and equity here locally. We're very proud to be part of a community that seeks to be informed and trusts us enough to ask us questions. So thank you for being here tonight. Thank you, people who, all of you who submitted questions ahead of time. We did pull some questions from last event as well. So if you had asked a question at a past event or someone you know did, we may get to it tonight. And then we also plan on doing a little bit of follow-up with people on some of the outstanding questions that were posed that we may not get to during the panel discussion. We are hoping to do that within a few weeks after this event. So just keep a heads up about that. Tonight I am joined by repeat panelists. I got Rua Hasabala, Brian Bradfield, Dr. Jennifer Scrimshire, and Tiffany Lewis, and then new panelist from the Health Department, Kathy Colson. We're really excited to have you with us tonight, Kathy. Huge thanks to these panelists for sharing their limited time and energy with us to help provide clarity on these important topics. I can speak firsthand to working with these folks that they are doing very fantastic work, working long hours, sometimes over the weekends, towards COVID-19 planning and operations, in addition to our usual responsibilities towards the community's well-being. So a huge thanks to these folks for taking the time out tonight from their families and the stack of work and emails that I know we all have. So thank you so much for your time. Thank you also to my co-moderators. I know we have Kurt Henning working on our video tonight and our audio. Thank you to Porter Arneal, who you heard a little bit from already. He's moderating our wait room and our chat later during our chat moderated live Q&A. Lots of hard work on Porter's part, and also on the PIO team, which is our communications branch, for promoting this and helping us get this information out there. So I am going to go ahead and hand things off to Porter, who's going to talk a little bit about some housekeeping.
Thank you, Alex, and good evening, everybody. As Alex said, my name's Porter Arneal, and I'm going to be handling the Zoom portion of the meeting tonight. And I just have a few housekeeping items for everybody to be aware of. First and foremost, this meeting is being broadcast and recorded on the City of Lawrence YouTube channel. So people can go back and view the meeting if they want to after the meeting ends tonight. When you're not participating in the meeting, please mute your microphone. When you are participating in the meeting, please keep your video on, but when you are not participating in the meeting, you can turn your video off. I just want everybody to understand that. If you turn your video off, you can still listen to the meeting, but by doing that, you, one, don't have to be seen on screen, and two, then others who are speaking will be seen on screen for everybody's benefit. No harm if you don't do that, but I just want to make sure people understand that they can do that. And if you have any trouble with your audio or your video, please just send me a chat. The chat is set up so that it will not be public, but it will go directly to me, and I will make sure I gather anybody's questions and make sure that gets passed back on to Alex for future FAQs, or if we have time tonight, we can entertain some of those questions as well. I may mute microphones if some kind of barking dog or somebody is trying to interrupt our meeting. And it's helpful if you remember to state your name so people know who you are, in case we have folks on here that are listening by telephone. And now I'll turn it back to Alex.
Thanks, Porter. Thank you for the reminders, technology reminders. I think a lot of us understand the Zoom world a little bit by now, but it's nice to have those reminders and understand, how this event is working. So thank you for taking the time to explain those pieces. Next, I know that a lot of people benefited from an introduction to what Unified Command is. At our last event, and some of you may have already seen that, and so I apologize for any redundancy, but I do think that it would be helpful to go over it very briefly again. So really quick here, I'm going to share my screen. This is the most up to date. I think at the last meeting we shared the same figure here, but this is the Unified Command. It's a pandemic incident command system, is what it technically is. And an incident command system has been around since the 70s and was later incorporated into the National Incident Management System in 2004 by the Department of Homeland Security. So this is a disaster and incident kind of planning and operations structure We're using the structure for the pandemic response as it allows for a cooperative response across multiple agencies and institutions, both within and outside of local government, to organize and coordinate response activities. It allows for common vocabulary and making sure that we're doing consolidated events like the event tonight and communications that go out to everybody so that everything is streamlined. The members, the top leadership members of the Unified Command include the Health Department, so Lawrence Douglas County Public Health, Lawrence Memorial Hospital, Douglas County Government, City of Lawrence, University of Kansas, USD 497, the public schools, and Chamber of Commerce. So those are some of the key players in terms of the Unified Command's leadership. And then we have these various branches down here. As you can see, my name is in the equity branch. I work with about 10 to 15 different people on that branch, just ensuring that equity and issues of access are looked at. We also have community well-being branch, a surveillance testing branch, for example, and then the vaccination branch, which of course handles vaccines. So it's pretty self-explanatory as you go through this, but this is a federal planning structure. Other sectors of the community that are represented within this that I did not list include places like the Lawrence Art Center, Lawrence Public Library, folks that don't have a formal role, but they're pulled in as volunteers to various of these branches, helping us make decisions. The current priorities, of course, are maintaining available hospital bed space, vaccination planning and administration, that's a big one, and community well-being during this time. So I'm gonna stop share. I know sometimes for me, it's helpful to know the behind the scenes, like who's in charge and who are the players, who do I look to for guidance and things like that. And so I hope that that brief introduction was helpful to you all. And I'm certainly not necessarily an expert myself. I've been part of Unified Command, now Unified Command. It helps to know also of the other resources that are available. We are going to hear a little bit from the Senior Resource Center tonight and potentially from the Community Wellbeing Branch. I'm going to share my screen one more time. This is our agenda. So as we're moving through remarks and announcements, resources is going to be next up on our list. We're going to move into introductions of our moderators and panelists. We're going to engage in a panel discussion and then open it up for live Q&A in the chat. I'm going to make sure that there's nothing else that the panelists would like to share with you all. And then we're going to have a few closing remarks and some repeat of some announcements. So now I'd like to hand things off to Megan Poindexter. She is a wonderful worker at the Senior Resource Center. I'm so proud to know her and to work with her in these different groups, even if we've never met in person because of COVID. So it's really nice to work with Megan. She's doing great work and her staff are doing great work. So I'm going to throw it over to Megan to talk a little bit about the Senior Resource Center.
Thank you so much, Alex. I'm really happy to be here. And yes, it's been really fun to get to work with Alex, and we will meet in person one day. So as she said, I'm Megan Poindexter. I'm the Executive Director at the Senior Resource Center. And I wanted to start off, I have a confession to make for you all. I play favorites because I have two seniors who I like more than all the other seniors, and they are my parents. My dad turns 80. He turned 80 in November, and my mom is just a couple of years younger. And when I think about how the world is experienced by seniors, I often use them as my litmus test. When I think about the digital divide, I think about how my parents experienced the internet. And so that's what we're going to just chat about a little bit tonight. For context, both of my parents were both very skilled, highly successful professionals prior to their retirement. My dad was an executive. He had a secretary and she typed 100% of his work for him. And when he retired almost 20 years ago, he had never touched a typewriter, much less a computer. My parents owned a retail business for 40 years and my mom ran it when she wasn't teaching Spanish. She kept the inventory and did all of the bookkeeping by hand in a ledger with a calculator. My parents have never purchased anything online. They share a Facebook page. They have 13 friends. They follow 0 businesses or media outlets. They have newspapers and magazines delivered to their house, and they subscribe to them over the phone. They don't visit business websites. They don't tweet. They don't Instagram. They do not TikTok. They are smart. They are capable. They are very engaged. And I haven't seen them since Christmas of 2019, when they live all of 75 minutes away because my dad has heart issues and we are taking 0 chances. So over the last year, The senior population has been front of mind like maybe never before. And after the individuals age 65 and older were immediately identified as an at-risk population for the worst that COVID can do, our society asked these folks to stay home to stay safe. And we have intentionally isolated them for over a year. We have always known that there is a digital divide for people who did not grow up with computers. But now we have told those same people that aren't supposed to leave their house that the only way they can get out of their house is to go online to sign up for a vaccine and complete online tasks. And by the way, the primary way that our society communicates at this time is through online media outlets. So I once heard someone talk about the differences between digital natives versus digital immigrants. Natives being the millennial generation who grew up with computers, and immigrants being those who adapted to computers, namely the Gen X. But many of today's seniors are more like digital tourists, and many of which require a personal tour guide. The Senior Resource Center's staff and volunteers have spent out just countless hours. And I say countless because I haven't counted them because it's just so overwhelming. Countless hours on the phones over the past 4 weeks, supporting these digital tourists to navigate the vaccine process. Our county leadership has to be commended in their desire and efforts to hear and respond to the feedback that I've shared with them about how this has and hasn't worked out, making adjustments to ensure our 65 plus community can get through this. But at the same time, we know there are at-risk seniors out there in Douglas County who are not signed up for the vaccine. And although we will keep trying, it is hard to know how we're going to reach all of them successfully through this highly digital process. Thank you.
Thank you, Megan. I really like the storytelling aspect of what you just shared. You basically shared what you guys do, but through a story and through your own personal experiences, and I love that. So thanks for sharing about your family and sharing your thoughts and your expertise, working at the Senior Resource Center and all of the great work that you all have been engaged in, especially recently with phase 2 opening up and us targeting those 65 and up older adults. So thank you so much, Megan, for your work. And I think if you're still around towards the end of this event, I'd love for you to speak again, just very briefly, letting folks know what you all do. So thank you, Megan. Next, does anybody from the Community Wellbeing Branch, are you present? Do you have something to share? I feel like you all were on the fence, potentially
Actually,
sharing.
me again.
Okay, awesome.
Earlier today, Margaret Morris, who is leading the Wellbeing Branch, asked if one of the others from the group could speak briefly. So I actually asked her to share with me what she would share if she were here. So um, she wanted me to share with everybody. The Community Wellbeing Branch is a coalition of Douglas County organizations focused on promoting social, emotional, and physical well-being, specifically in relation to the effects of the pandemic. We share resources and information about specific challenges that different sections of our community are facing right now to mobilize impact and support within the community. Succinctly put, to mobilize people to lift each other up and help each other out in this time of crisis. 2 initiatives that we are mobilizing around right now are the steep rise in suicide and suicidal ideation in our young adults. We've seen a 24% increase in suicide-related visits to the ER, and the increase in isolation and feelings of loneliness and hopelessness in our senior population, which is why I'm part of the group. Tomorrow afternoon, we are hosting a community lunch and learn. COVID-19 and Youth Suicide is the title, with the Douglas County Public Health and Headquarters to build awareness and provide prevention resources for anyone interested. It is a Facebook, we do have a Facebook event page, and I will post that in the chat. Does that work, Alex? Here in a minute?
Yeah, I think you can put it in the chat, send it to Porter, and then Porter, maybe we can send an email out to everyone, or we can publish this on the event page as well for this event. So yeah, I think that there's a way to make that happen.
Okay, very good. The other initiative is a Neighbor to Neighbor initiative. It's a campaign in partnership with the Senior Resource Center to mobilize neighbors and neighborhoods around helping seniors by reaching out in informal and simple ways to help the vulnerable folks in our community stay connected and healthy. and remind everybody that we are still all in this together. We have asked the Lawrence Neighborhood Association to hold small house gatherings via Zoom to have simple neighborhood conversations around 3 questions. 1, who needs help? 2, what do they need? And 3, how can we get it to them? The last thing that I think hopefully people have seen is the free DGKS Hope yard signs around town that you can pick up at Burt Nash, the Lawrence Art Center, or Parks and Rec facilities like Holcomb and the Sports Pavilion. And the last thing, we do have a neighbor to neighbor. Part of that initiative is a really lovely signage that we're going to start putting out into the community in the coming days with some specific examples of how a neighbor can help a neighbor. And because sometimes we want to do something, but we just don't know what, and that can overwhelm us, and just then we don't do anything. So there's some really simple ideas that we share in that flyer. So we do invite folks in all parts of the community to join us in these efforts. If you're part of a neighborhood association, keep an ear out for one of these upcoming house meetings, and we hope to hear more from the community soon.
Thank you so much, Megan, for sharing it in multiple fronts. Thank you. Thank you for coming tonight. I am going to go ahead and kick it to, first I'm going to share my screen. So first I'm going to share a little bit more. I know we're dying to get into the questions, so I'll move pretty quickly here. And these are also resources that I did cover the last time that we were together a few weeks ago. But these are a couple of resources that you can access online if you're online literate and you think that you can navigate these pages. We do have this hub, the coronavirus hub. This is by the county and some other partners, but this is updated daily or almost daily. And this has the consolidated the numbers across Kansas, across just our county, information from specifically our hospital. You'll see information about the vaccine interest form, very in-depth here. This is more in-depth than you might see on a social media post or something like that. This really walks you through what you can do. And then of course, if you need assistance, again, we have the Senior Resource Center's number here on the screen. It is very small font, so I'll share it 785-842-0543. And I'll do that one more time. It's 785-842-0543. And we do have a hotline that's in development. The number is currently not ready to share yet as things are not finalized, but we are going to have a centralized number as well for just general help regarding the vaccine. So keep an eye out for that as well. This is very detailed. It shows you literally what screen you'll receive when you've successfully registered, all of that good stuff. It explains what phase 2 includes in a little bit more detail. Oh yeah, also watch out for vaccine scams, by the way. You should not be paying to get the vaccine. Definitely watch out for those. That is very rampant right now. Also details on, this is new since our last event. This is new to the hub, but we are publishing how much of our vaccines, dose 1 and 2 of both of the brands, are being received and administered. And then a percentage, just, they do the quick math for you there, what percentage of those then that we received we have administered. Also, it consolidates it into all dose. So you can look at it by brand of Moderna and Pfizer. You can also look at it by all doses. And so this is a really great resource. You have information about the Max vaccine events. You have videos if you want to listen to medical professionals or our own community members talking about getting vaccinated. Those are linked to there. So that's the coronavirus hub. I'll scroll back up to the top again. And since the chat is open to all, I think what I can do is I can go ahead and share these in the chat. I'll go ahead and share these in the chat when I turn things over to Rua for our last announcement. Next, we have the City of Lawrence's page, and this also has a lot of great information here. What I really like about their page is that they do have date-stamped pieces to read about local COVID-19 responses and some of the different guidelines throughout time. So that's very interesting. And then we have, last but not least, also the Lawrence Douglas County Public Health, their information. It's pretty easily laid out here. What I do like is that you can see all of the announcements and health orders, and you can kind of scroll through here to read those. we also share about which vaccine phase that we're in. We do have an FAQ document accessible as well, so that they can answer some of the most common questions. We have a list of resources here. We also have 2-week graphs as well, the 14-day moving averages that people can take a look at. We also have an outbreak breakdown showing us where the outbreaks are predominantly at as well. And then our test positivity rates. Lots of good stuff. So I think the last piece, I already shared that. Okay. So now that the chat is public, I will drop some of those into the chat in case you want to save those links or open them up on your browser before this meeting is over. But I am going to turn things over to Rua. She's our last announcements for the night. She's going to talk about testing.
Hi, everyone. Thank you, Alex. I just wanted to share that this Saturday from 10 a.m. to 4 p.m. at the Merck parking lot, we're going to have a free COVID test handout event. So be on the lookout for that information. But basically, we're going to allow people to take tests home, and you may just come pick it up. There's no wait time. There'll be volunteers there. And this is a partnership with LMH, Lawrence Douglas County Public Health, Lawrence Mutual Aid Network, and the Merck. So that's Saturday from 10 a.m. to 4 p.m. People can just pick up tests, and we'll be definitely sending out that information, but just wanted you all to know.
Thank you, Rua. I'm going to go ahead and pull up the image that you shared as well. Here we go. So Rua's going to talk a little bit about the difference between equality and equity. I think at our last event, there was a lot of confusion about that, and obviously terms kind of changed throughout the decades. And since one of our topics tonight is equity, we thought we might just clarify that really quickly for you.
Thank you. Yes, I'll just go ahead and briefly share because at times folks ask, what is the difference between the two? And so I just wanted to share that equality means each individual or group of people is given the exact same resources and opportunities. So as you can see in this visual at the top, everyone's given the same type of bike, regardless of their differences. So it's that one size fits all approach that may and does not work for all. But equity, on the other hand, recognizes that each person has different circumstances and then allocates these resources or opportunities to fit their need based on that individual need. So equity is more of that justice focused type of approach. And when we think of health equity, it's asking questions on how we can ensure we meet people where they are. So just like Megan talked about earlier, with populations that are facing internet access issues or, are, as she shared, not tourists related to the internet. It's about how do we meet people where they are. So that's that difference between equality and equity. And I like the visual. So just wanted to share that.
Thank you so much, Rua. That was a really great suggestion because we did get quite a few more equity questions for this panel. And so I think that that's going to be really helpful for everyone to understand and know. So thanks for taking the initiative to present about that.
You're welcome.
So I'm going to share my screen one last time. All right, our lovely panelists. So we are entering the panelist discussion. Just a reminder, we have Kathy Colson from here at the health department. She works with me and I didn't even introduce myself. I'm Alex Kimball Williams. I work at the health department. I'm the health equity planner. So that's what I do there. Just heads up. Also, we have Dr. Jennifer Scrimshire. She's our sitting kind of medical expert that we have on tonight. We do have a couple of kind of medical specific questions on the docket for tonight. So thank you, Jennifer, for making time for us. Of course, you've heard a little bit from Rua Hasabala. She works with me here at the health department, and her specific, she works within testing equity, but she's also part of the equity impact advisors with me. And so we work in all things equity, especially around access for folks. And then next we have Tiffany Lewis. She works at Heartland Community Health Center. She's also got she's a nursing background like Kathy. And then we got Brian Bradfield, our sitting person from LMH Health, which, as a lot of you know, is probably the main hospital in Douglas County. So now that you've been reacquainted with our panelists and our new panelist, Kathy, let's just jump right into it. All right, so first question is for either Dr. Scrimshire or Tiffany. Why do some people react more strongly to their first or second dose of the vaccines?
Dr. Scrimshaw, you can go. I'll have a short answer because the second dose, your body's used to it and it's having a stronger reaction, but I'm pretty sure you can speak to that a little bit more eloquently than me.
No, I think that's a great response. I mean, with the first dose, you've primed your immune system. It's now alert and ready to act immediately, and as well as the different parts of the immune system. There was, I think, was that part of this question between young and old people, Alex, do you remember?
Yeah, there was another question.
Oh, sorry.
Are there differences in how people respond, maybe based on their demographics too? That could be, yeah.
Yeah, we're seeing that younger people tend to have more severe responses. And I don't want to say severe, I don't like using that word, but more robust responses, how's that, than older people. And that just has to do with the immune system as you age. We know that, we have to give different higher doses of flu vaccine to older people. The immune system just doesn't work as well. That does not mean if you don't have a reaction or you don't get chills or soreness from the vaccine that it didn't work. That's not at all what I want to convey. Everybody's body is a bit different, but the bottom line to answer the original question is, yeah, your immune system's primed and ready to go, and so it attacks things more quickly and more vigorously.
Thank you, Doctor. I think that was a really great response and something that people here might be especially curious about, since phase 2 does prioritize older adults. So thanks for expanding on that. Next question is also for you, Dr. Scrimshaw. What's the scientific rationale behind the new quarantine guidelines for those who have been vaccinated? So as some people may have seen, we are now advising that, after 2 weeks or 14 days after your second dose of either vaccine, that you do not have to quarantine if you've come into contact with someone that is COVID-19 positive or might be COVID-19 positive, that as long as you're asymptomatic, that you do not have to quarantine. So if you could expand on maybe how that decision was reached, or the rationale behind it if it wasn't a local decision.
Oh, it was not local at all. That decision was made high up. It's similar to infection. Your body has now produced antibodies and you're considered protected for the most part from infection. It's not 100%, but for now, we expect that most people will have developed whatever immune response they're going to develop within those 14 days after they complete the vaccine. And then you kind of have a 90-day pass. For now, I think it'll be extended, but for now, for 3 months, you don't have to quarantine if you're exposed. Again, it's not 100%. So if you develop symptoms, you still should consider yourself potentially infected. But yeah, it's similar to a post-infection, your immune system's hopefully protecting you.
Thank you. I'm going to bug you one more time with a follow-up question. How long is the immunity provided by the vaccine? What is the guidance for people to revaccinate potentially in the future?
We don't know yet. We know that it's at least 4 months. We think it's probably going to be a year, at least a year. But I think every vaccine might be a little bit different. But I expect it to last around a year. Was that all of the questions? Sorry.
I think so. So yeah. No, let's see here. So there's a couple of kind of related questions. So definitely expand here. If there's a difference between Moderna and Pfizer in terms of effectiveness or risk of reactions, this reaction sometimes to first or second doses. And then also if there's an effectiveness of either of those vaccines after just the first dose that you might feel comfortable speaking on.
Is that to me or to all of us?
Yeah, I'm sorry to bug you again. I think you might be the best positioned, and then maybe Tiffany or Brian too.
Tiffany, you can take the side effects. I'll take the you can take all of it, Brian.
Well, I can give part of it. So Pfizer and Moderna are both messenger RNA style vaccinations. First dose vaccination efficacy for the Pfizer is 52%. Moderna is roughly 80%. Second dose for both Pfizer and Moderna, both round out to around a 95% efficacy. Johnson & Johnson, which is probably the next vaccination that will come online, as a viral vector, so a little different type of vaccination. It's a one-dose vaccination, and it's looking to be around 66% efficacy on that, meaning and can fight off the disease.
To piggyback a little bit off of what Brian said, the side effects are different in different populations. Some for the first one really have big side effects, and some have no side effects. Definitely, we see more side effects in the second dose. I'm not sure if you all can hear me. Can you all hear me?
We can, yeah.
So we definitely see a lot more side effects in the second doses. If patients, which we had a handful, did have a severe reaction to the first dose, we did tell them to consult with their family practice doctor and the doc that was on staff to see if they should attempt to get the second dose. And we did have some that were advised not to get second doses. So it is a patient by patient, case by case scenario. I hope I got it right, Dr. Scrimshaw, this time. So I'm gonna have her with the final remarks.
Oh, no, you're good. I was going to comment on Brian. It's interesting when you look at people who only got a single dose of these two vaccines and then look at them over time. So, say you don't get the second dose and look at it a couple months later, but they still have quite a bit of protection just from a single dose. I'm not promoting that. You should still get both. But I don't want, if somebody is in a situation where they cannot get the second dose, there's still a good bit of protection just from the long.
Thank you each for touching base on that very complicated kind of questions around the efficacy or the effectiveness of both of those vaccines, first and second doses, all of that stuff. So you also eloquently covered that for us. Thank you so much. This next question is for Brian. What is the criteria for being randomly selected for the 65 and older clinics at LMH Health, or is it truly random selection?
Yeah, so in the beginning, we had two different processes until we merged with the health department on the patient selection. So the current process right now is people that fill out the vaccination interest form go into a pool. Out of that pool, the health department pulls out random names for that number of vaccinations we're going to do in that population. And those are the people that are then vaccinated. Right now, we're doing in the 65 and older group, 40% of our total vaccinations that we receive that week get dedicated to that patient population. So that's roughly between 800 and 840 community members that get chosen. Their names are completely pulled random. Right now, sometimes that does match up, a spouse or a significant other in the same household. Sometimes it does not, but they are completely randomized from the master list.
Thank you, Brian. And this next question may be for you or maybe even for others on the call, other panelists. Where can I find out the demographics of who has been vaccinated in my community?
So right now, we don't share the demographics as far as race, ethnicity, and what have you. There are some governmental regulations around what information you do share, so you don't intentionally or unintentionally isolate groups and numbers. In our equity partner group, we are looking at those numbers to see how the vaccinations stand up. I know there's, I think, a question later down the road that, there's more prominent white people in our population in Douglas County, but a higher level of people of color that have disease processes going on. So we are looking at it. We don't actively share it. I did look up just to give an idea from a number wise. We are splitting out each of the groups within phase 2. We're trying to find a good way to track how many people in the 65 and older group that have opted in have been vaccinated, how many in the critical worker, like the restaurant, hospitality industry, those types of things. We don't have that discrete number now, but I can give you numbers, kind of just an idea of what we received or what we have given vaccinations in Douglas County. So out of Moderna phase 1 and 2, so dose number 1, we've given over 6,000 doses. For Moderna dose number 2, we've given almost 3,000 doses. Now, there is a difference between those two, and a lot of that's just based on the 28 days that we have to wait. So we are receiving doses ahead of the time before they actually are due for their booster dose. So that's why we have kind of a residual sitting. Out of the Pfizer selection, we've got at a dose number 1 for Pfizer, almost 11,000 doses have been given out. And dose number 2, we've given out almost 3,400 doses for dose 2. And again, a big difference just because we have a 21-day. When the state sends us our doses, they are dedicating whether it is a prime dose, which is the first dose, or if it's a booster dose, which is a second dose. So they dedicate our allocation, and then we hold back those doses for that vaccination clinic.
Thank you, Brian, so much. Next question is for Rua and Kathy, or whomever else feels like jumping into it. Can my employer require me to get tested or vaccinated?
I can start on that one, and Kathy, feel free to fill in. For me, whether it's an absolute requirement, I can't be certain. I know that employers have requirements and it's more employer specific, so I can't really speak to the legality of such rules since I'm not a lawyer, but I know that employers are the ones that kind of set the requirements for that.
I agree with that. It was for testing and vaccine. You cannot be forced to receive a vaccine, but different employers may have other options then that you would need to follow. Somewhat like the flu vaccine is now required in most hospitals of all their employees. And if you choose not to do that for whatever reason, then you will have to wear a mask all the time during flu season. So there can be differences in how that's approached. As far as employers, I don't believe it is also a requirement, or you can't be forced to test. However, an employer then could turn around and have you not work for a certain period of time, especially if you seemed symptomatic or there was some suspicion that you had been exposed and maybe were suffering symptoms. So employers have some options, but as far as forcing the testing and the vaccine, they have to offer those options.
Thank you, Kathy, for the clarification. I know we have quite a big critical worker infrastructure part of phase 2. So thanks for speaking to that. And also Rua for the testing piece, because that's a really big part of any type of reopening plans and we're in consistent working plans that we have going on right now. So thank you both. My next question, and Ryan, you kind of already answered it a little bit with the randomized selection clarification, but does being over the age of 65 and a critical worker put you in front of the line, especially around maybe the waiting list or things like that? Is there any part of this process where we're belonging to both of those groups would prioritize someone above others?
Right. So we don't have a process that puts someone in front of someone else within that line. We're not doing the prioritization. We are following the state's plan around just creating the groups, not so much any type of health condition related. You do, when you fill out the vaccination interest form, you do self-attest to which group you fall into. If you do fall into 2 groups, then your name could be randomly pulled from 2 separate lists. So if I'm 65 and older, I could be pulled randomly from that list. Or if I'm also still working and I'm a critical worker, my name would also go in that list. And you could be potentially pulled twice or have the ability to pull twice, which would potentially increase your ability to randomly get tested. But it's also, you have to self-attest, or hoping people fill out that form, open and honest. And but we don't move people ahead of one another.
Thank you so much. That was a question that I received quite a bit from some folks, so thank you. Next question is for Rua. What is the most accurate COVID-19 test that people can easily get?
That's a great question, Alex. So for the types of tests that are most accurate, we think of those that are molecular tests. So right now there are the nasal swabs, which are excellent. And then also the saliva-based tests, these PCR tests, when you are collecting your sample, they are the ones that lead to accurate results. And when I think of the sample that's collected, that's super important in how accurate your test result is. So when it comes to collecting a saliva sample, for example, just ensuring that you are filling up to the line and in collecting a quality sample, not eating beforehand for 30 minutes before that, or drinking anything or brushing your teeth. And so the quality of the sample is really important, but those community tests that you're seeing, whether it's at the Walmart site or the ones from our initiatives, as well as nasal swabs, they're all really great for accuracy in testing.
Thanks, Rura. That's really helpful to know because there's just like we have a couple of different kinds of vaccines, we also have different tests. And I think that's been a constant question for people because I mean, I think that people understand that there's a swab test in the nose or throat, and then there's also the saliva test. And I think that that's the extent of a lot of people's understanding of the tests. So thanks for giving us a little bit more background. My next question could really be for anybody from our vaccination planning unit who's one of our panelists. But what was the rationale of moving forward into phase 2 before phase 1 workers were mostly taken care of? Or were they mostly taken care of before moving into phase 2?
Kathy, do you want to take that or would you like me to?
Yeah, no, I'm happy to start with that and add in Tiffany and Brian. This was a decision by KDHE. We were also a little bit surprised because we had not felt like we were done with healthcare workers, but they, as a statewide decision, they felt that we needed to just get moving into phase 2. And so we did that. Now, you also have to understand with these phases, as we move from one to the next, we're not done with the previous phase. If you were a healthcare worker and you are now in phase 2, we are not going to ignore you for your need to be vaccinated, but you will just become part of this bigger group. And the same thing will happen with phase 3 when we start getting into chronic illness. Those of us who had still not gotten vaccinated in phase 1 or 2 are still included under that new phase, if that helps. Tiffany, Brian?
I was gonna piggyback and say the same thing. I mean, the phases are moved by at the state level. We try to keep up accordingly. And just because you're in phase 1 doesn't mean we're all responsible for a subset of people to vaccinate. So we're trying to make sure we stick in those phases. We might need to just put it out there. Some of the people in phase 1 never got back with us. We had sent out calls, sent out robocalls. Information wasn't updated. I'm not sure if Brian wants to speak to that, but we had some technical difficulties in getting in touch with people in phase 1. And we got that first dose around the holidays. So a lot of people were traveling. So I think that goes to play, but we're definitely working them in. They're just in a more randomized pool.
Yeah, I would add, we also have some just late bloomers, people that were kind of unsure. Even at LMH Health, we had a percentage of employees that weren't quite certain they wanted to receive the vaccination. And as more and more people get vaccinated and they see that the reactions are not as bad as potentially they thought they would be, they're getting interest. So as we moved it to different phases, phase 1 right now is allocated a portion of our weekly doses. So I believe it's 5% is allocated back to phase 1 to make sure we don't leave anyone behind in that phase. We keep track of what that total volume is, and we could adjust that allocation as needed. And we'll see that happen when we move into phase 3 as well, trying to keep track of how many people have been vaccinated or has not been vaccinated in that group and decide what percentage needs to be reallocated to keep that phase 2 going. So.
And I think someone asked when we as a county moved to phase 3. I think we moved with the state. Kathy, Brian, am I? So
that
the
is
state
correct.
When we will move to phase 3. So the county does not move. We follow state regulations until if and when the federal government decides to intervene. Right now, we're following our state regs.
That's correct.
Yeah, and just to assure the group too, even today we had a vaccination meeting and we're discussing what phase 3 might look like. So we're trying to think a little further ahead, knowing the state will move us as fast as they'd like to move us. And even though we may not be ready from a vaccination percentage standpoint, we need to be ready to service that group when the state tells us to. So.
And I want to answer, it says, can those who qualify for phase 2 but haven't been called to come to vaccination events wait and see? Yeah, we do have last minute extras that we do go back to that list and we call. I know LMH does, I know Heartland does. So, but it's still randomized when we go back to call, they pull another randomization of that list. So just know that I think it's about 30,000 people on that list. I don't know if that number is still that high, but it's a very high number. And whereas we may have only 5 or 10 people not show, it's just a randomized pool of another 5 or 10 people. And if we get in contact with those, it stops. But if we can't, we'll keep calling. We will not waste doses.
Right.
Yeah, thank
Oh,
you. Oh,
no, that's okay. I was just going to add, so just to clarify with Tiffany is if you hear there may be extra doses, please don't line up because we're not just receiving people to show up at the clinics and then just randomly give doses. We're trying to do it under controlled manner so the people that are on the list get called from the list.
Thanks, Brian. I was just going to answer that question. To not just show up or to hang out and see what happens. That's not working well. If we do have extra doses, we're going back to the lists and seeing if we can't pull more names and get them taken care of with whatever we may have.
great. Thank you, each of you, for delving so deep, I think, and, being part of the vaccination planning unit with you guys. I just want to reiterate that, a lot of these decisions are made above us. We have a little, like a tiny little bit of influence. We go to state meetings and things, but, there's so much changing that the county then has to act on that we didn't necessarily decide ourselves. And so, as you're seeing different information coming out, we promise you that it's not necessarily a result of us not being organized or us changing our minds and not alerting you in a reasonable, timely fashion. But a lot of times we are receiving new guidance, new things to put out, new changes of phase and things like that. And we're doing our best to be transparent and to funnel that information to the community. But we can't necessarily control how much new information that there will be. So definitely hang in there with us, in terms of the stuff that we're putting out on our websites, newsletters, social media, print, things like that. Anything that you're hearing from us as things are changing, we promise we're not trying to be confusing. So thank you, each of you, for the great work on the vaccine planning unit. I think the next question is also related to vaccines and kind of the phases. So somebody says, I was really glad to hear about the initiative to get more vaccines to people of color in our community. Is that just for people of color who qualify under phase 1 or 2?
Yeah, I can take that one. So in help with Alex and Erica Hill and quite a few others and our equity partners in the community, we have been more intentional around people of color, people that have kind of dead zones as far as hotspots or internet access. We are sticking with the phasing plan. So those groups are chosen at 65 and older, critical workers, hospitality, restaurant workers, those type of people. So we are staying within the phases in that group. And as our phases kind of shift into phase 3, we'll also do the same thing with our equity vaccination allocations to try to mirror the rest of the program.
Thanks, Brian. It's so funny asking you all some of these questions that I know the answers to, but I love to hear the way that you all say it as well. So this is really interesting to me. So yeah, thank you, Ryan, for speaking to that. There will be more, a little bit of information going out into the community as we get a few first equity clinics under our belts. So keep an eye out for that. The next question is also about, I guess, kind of speaks to people of color and also older adults. This could really be for any and all of my panelists. And if there's anything that you all feel spotty about, I'm happy to jump in and help provide clarity as well. But the question is, people over the age of 65 are disproportionately white, while those living with many chronic health conditions are disproportionately people of color. Has there been any discussion around sub-prioritizing those groups, taking those factors into account? I know we've kind of touched on that a little bit through some of our other questions.
So, okay, I'll try and
Go ahead.
start. I'll try. There is some work with the equity impact partnerships that Alex and everyone are beginning. Erica Hill, there, as Brian just said, we're becoming very intentional about trying to find people that may have been missed due to, for whatever reason, so that we're just trying to be very deliberate about bringing that all to everyone. I'm not as good as Alex is with the words, but that's the only thing I know to say um, at this point in time. We would still be working within the phases. So I think that will help by staying in the phase. If you're 65 or older, then you have another process out there that's working very diligently to make sure that everyone is getting vaccinated. Does that help? That's the start. Someone else was much more eloquent than I am.
I would add, there's been a lot of discussion around prioritization within each of the subgroups, whether that's 65 and older, whether that's the school district, whether that's hospitality. One thing we all need to keep in mind is our allocation per week is directly proportional to how quick we can get vaccinations out to the community. So the slower we go, the less doses we receive. We realize that prioritization definitely would help in some areas and may not help in others, but it's also access to data. How do we get that information? How do we get it rapidly? If you think of prioritizing the 65 and older group around health conditions, that's making the assumption that everyone 65 and older goes and sees a physician routinely, which then would leave out another subgroup of people that don't go see a physician or provider routinely. So our goal is to try to reach as many people as quickly and easily and safely as possible to get the vaccinations. We're going to launch our clinic tomorrow at the fairgrounds and do our largest clinic to date, 2,500 in one day. And if we can continue to do it at that pace and get more doses, we will move quickly through phase 2 and then hopefully launch into phase 3. So there's a lot of ideas and thoughts around it. We do discuss it in our clinic vaccination meetings and just trying to do the best we can to serve the community.
Yeah, the equity impact advisors have been amazing, and every time we look at making a decision, you often want to view it through that lens. So take, for example, trying to subprioritize by age. And if you pick a certain age group, you may exclude minorities by default. So similarly to the health conditions, by picking health conditions, you're assuming that that person is hooked into the healthcare system, which means they have potentially more resources than another subset of people. So, intentional is a very good word, and cooperative. It's great to have that group to help, remind us of the decisions that we make and the additional impacts they might have.
Mhm.
Thanks each of you for speaking to something that I'm actually leading. So thank you for trying to talk about that. I know I put you on the spot tonight. But yeah, I think the only thing that I would add to it is, we're looking at different kinds of barriers that people are experiencing. The three of our panelists that just spoke named quite a few of those. Other ones that we're looking at is issues of transportation, people that have issues of mobility. People, I think somebody had mentioned access to internet, but also access to devices and ease of use with devices. Is someone comfortable or knows how to navigate a device? We're also looking at language barriers, so non-English speakers. Also at literacy being a barrier. If someone can't actually read the information about the vaccine clinics or, fill out forms themselves, then obviously that's a barrier. Looking at people that deal with housing instability, people that deal with medical mistrust. That's a really big deal for quite a few people. There's a lot of misinformation going out there, and then also just groups of people that have historically been left out or negatively impacted by the healthcare systems. We're also looking at people that have significant mental health needs, neurodivergence, people living with disabilities. And then, like I think Brian may have mentioned, having no connection to a healthcare system is something that we're looking at. And then also people that, maybe they're unofficial sole caregivers for people who are at risk, people who would otherwise have difficulty getting to these mass vaccination events. The list goes on. I've listed a few things. So there's quite a bit of planning happening among the equity impact advisors and in the vaccination planning unit. Obviously, RUA is working within the surveillance testing unit as well. Equity impact advisors have been sprinkled throughout the whole unified command structure so that there's people in those rooms at those meetings, at every one of those meetings, basically asking and advocating for people that may not be, your typical patient or your typical community member, the default person that we think of who's, able-bodied and, young person, whatever. So I think that we do have people in those rooms making those calls and helping inform those decisions.
And I just want to add, I think Douglas County is very fortunate to have this group. Even just starting when we all started a year ago and having Alex be able to join us has been very helpful in any conversation to help remind us of things that we may not think of during a conversation. Well, what about this or what about that? And that's the kind of thing you need to be able to stay as diverse as we are trying very hard to be. We need those reminders. We get caught up in other things, and the reminders are very helpful in any conversation. So I appreciated that from the get-go. I see some questions over here too. I thought I might just answer. There's
I'll just. Sorry, Kathy. No, we're gonna blow through the last remaining pre-selected questions from the last panel and the last emails that we got, and then we're gonna jump into those questions.
All right, sorry.
So
Thank you.
Just to be equitable, right?
Yeah.
That's the power word of the week. So we're going to blow through our final questions, but thank you, Kathy, for being proactive and starting. If our panelists, if you're not actively answering one of these last questions, if you do want to start browsing through that chat so that you can see what some of those questions are, I would appreciate it. Start prepping yourself for some answers. But just really quickly getting through the last, we just have a handful of questions from before. I want to make sure that we're mindful of people's time. So next question. So this could be for Rua or Tiffany. There is significant reluctance to get the vaccine in the African American community. What do you suggest that I do as an African American myself to encourage those around me to get vaccinated?
So, Rua, I can go or you can go.
Yeah, you can go first, Tiffany. I'll hop on after.
So we know that this disease with other diseases disproportionately affects African Americans. What we also know is the systemic reasons behind it. Holding groups to educate African Americans about the COVID-19 vaccine is going to be able to help them get acceptance, but they have to see stories from more people that look like them obtaining the vaccine. If you go into an African American community or talk to some African Americans, the first thing they think is the Tuskegee study, and it was unethically done, and it brought about something. So there is some very legitimate skepticism there. What I can say is with this COVID-19 vaccine is there's a lot of literature out there. I've even done a video to educate yourselves and to let's change this cycle and let's figure out what questions you have and go to the experts. Don't listen to your neighbor. Don't listen to anyone else. Dr. Scripture has been very key. If we want to ask questions, she'll answer those questions. There are people at the state level, Dr. Lee Norman, they will answer those questions, but we have to change the lens of how this study is being viewed. And the only way to change it is to start speaking and educating about it.
I agree with Tiffany. I think you 100% captured that. As a Black woman, I understand that there are these historical injustices and, like Tiffany mentioned, historical mistreatment of underserved and Black communities. So I would first start by identifying what people's questions are about the vaccine and hearing their concerns. Now some folks might wonder, why was it so fast? And so we can perhaps share that there were lots of resources put behind this. And also questions about, am I represented in the clinical trials? Does this work in my population? And so we can share that there is literature, as Tiffany said, out there that shows that these vaccines have been tested in Black communities. And so I think just meeting people where they're at, right? And sharing that these vaccines are a public health initiative that are wide ranging, that they go across populations and that it's to benefit everybody. And so I think it just starts with identifying what people's questions are and being able to address that. And then in turn, that allows people to feel more like they're represented and for them to be a part of that process as well.
Thank you both for speaking to that. And to your point, Rua, about the clinical trial participants, just since you brought it up, both Pfizer and Moderna had around 10%, just under 10% of their clinical trial participants were African American or Black self-identified. So that's pretty hopeful compared to, things used to be much less than that. So that's some words of encouragement for people who may be listening that are or they love Black or African American community members. So thank you both. Just blowing through these last questions. If your child has health issues putting them at risk, What phase do they fall under? Is it still phase 5?
It depends on the age of the child because the studies for Pfizer, it's 16 and older, and for Moderna, it's 18 and older. There's not a vaccine for anyone right now under the age of 16. So, it would really be if your child is 16 or older, I would ask Dr. Scrimshaw to speak to her to 18 or older for Moderna.
Whether or not the what's in the works for children. I mean, how say that again?
If your child has a health issue that puts them at an increased risk, what phase do they fall under?
Is it the phase of the parent or the phase of the child?
It just says the child has a health issue putting them at an increased risk. What phase do they fall under? That's why I said I didn't.
So I think I saw a similar question. It might be the same one. If someone correct me if I'm wrong. If you are considered a caretaker for someone in your home, you're eligible. So if that child is sick enough that you have to take care of them and their health issues in your home, then you may qualify under phase 1 as a healthcare provider. But otherwise, it's just what other phase you would fall into normally. And of course, there's nothing yet for kids. What I was going to say is, as with other vaccines, you figure out if it works in adults for the most part, and then you slowly go down the age group. So you take 12 to 16, 9 to 12, 5 to 9. I'm making those up, but that's what's happening with these vaccines as well.
Thanks for chiming in on that. We do have a few questions that were remaining, but we have met our time and we need to go ahead and open it up to some of those chat questions. So these remaining 3 questions were about the potential protective role of COVID-19 or of the pertussis whooping cough vaccine in regards to the COVID-19 vaccine. So very interesting. And then another question about people who are unemployed or struggling with poverty and how are they qualifying within these phases, and then of course the way that physician bias may have impacted the health inequities during the COVID-19 pandemic. So those are very interesting questions that would have been great to have discussion about, but it sounds like we're going to be doing some email follow-up instead with those. But I did want to put those out there as questions so that if people felt like re-entering those type of questions into the chat, because you folks here tonight really want to learn about that. Just wanted to put those topics out there. But let's go ahead and start working through the chat here. Thank you so much, Porter, for moderating this chat. So
I think Scrimshaw answered most of them, or somebody.
Oh, great work.
I just answered a couple. Sorry.
Nice multitasker. Awesome. So let's see here then.
There was one question in there, Alex, around I had labeled 40% was going to 65 and older group, and the question came, where does the other 60% go? I'm not in front of my computer, and I don't know if Kathy, if you're in front of your computer for the county plan that could list out the other percentages for the group.
I'm at the computer. I don't know that I can find Charlie's big chart, but I think when I was reading that, I think what we were trying to say was out of 100% coverage, each different category was given a percentage that we would pull from, correct, Brian? And so currently out of the 65 and older group, we're pulling 40% names, 40% of the names every week when we're doing a clinic. So
I believe 25% goes to the school. I want to say 20% goes to hospitality.
I think it's around there. Then
10% goes to the government and local. And then I believe there's a 5% that goes back to the phase 1 people to catch up. I don't know if that equaled 100.
But it's like that. So yeah, it's not like if I'm reading the question right, we're not ignoring the other 60%. So every week we're just pulling 40% of the names out of that particular pot for what we have for this week to give.
Right. Yeah, but there is dedicated percentages to each of the groups, so we know exactly what numbers or what vaccination doses are going where.
Yeah, and both of
Then-
you correct me. Oh, sorry.
No, go ahead.
Correct me if I'm wrong, I'm part of these meetings, but, maybe I'm incorrect. It sounds like, in terms of our considerations for the different percentages for each of those buckets within phases 1 and 2. So, people that are healthcare workers, people that are older adults over the age of 65, certain types of critical workers. It sounds like we did a little bit of population estimation to kind of gauge how much percentage we might put towards those different groups. Is that correct?
That is correct.
Okay. So there's a little bit of rhyme and reason then behind the percentages.
Yes.
Yes. Awesome.
Thanks for
And
pointing
then,
that out, Alex.
yeah, no, I think that was
Thank
just
you.
maybe a missing link. And then I think with the vaccine interest form, people can select what critical workforce that they may be part of, what underlying medical conditions that they may have, their age and things like that on there. That's how we're sorting them?
That is correct.
Awesome. Again, I know the answer to this, but but let's look through
It's kind of like I'm playing a Jeopardy game. What is?
Yeah, right. I should do this in our meetings. Just quiz everybody. So I'm looking through the chat. So because some of you have been so kind as to start answering some of these, I don't want to repeat questions, but there's some really good questions in here. And maybe there's people who aren't looking at the chat, and of course the recording that's happening right now. So just because something was answered in the chat doesn't mean that it's part of our recording necessarily. So I'm going to go ahead and ask a few of these. And again, if there's redundancy, I apologize for that. I think that one of the prominent, oh no, Tiffany answered that about phase 3. That's right.
So it's 2 new ones down towards the
Yeah,
bottom, Alex, if you look at those two.
let's see. So what advice do you have for people who will get vaccine number 2 in regard to mitigating? Okay, I think their question is what can people do about the side effects that they're experiencing from dose number 2 from these vaccines?
Take Advil or Tylenol, acetaminophen, ibuprofen, Aleve, any of the NSAIDs or typical pain relieving medications.
Great.
I could go through the list of nap when you can. Take a day off work if you can. There's a lot of things you can do. But
thank you. I think there's another question here in the chat that I know that Kathy answered in the chat itself, but this is a really great question: is if vaccines are only available for American citizens?
No.
Sorry, trying to get that on. So vaccines are available to anyone who fits the current phases that we are in. We are not asking for proof of residency or any of that. So sure, we may be giving some vaccines to people who are not citizens, but that's not something we focus on. The focus is to offer the vaccine and try and reduce the spread of this disease and protect the community as a whole. That's where the focus is.
Thank you. Another question from the chat that I'm looking at that I think I've actually personally received this question from quite a few people that I know. I'm of childbearing age, and for whatever reason, a lot of my friends that know I'm part of the vaccine work are asking me questions regarding, their young children who may be at risk and should maybe because they have young children who are at risk or even older children that have underlying health issues. Would those adults in that household be prioritized to get vaccinated for any reason? Is that kind of going back to what Jennifer was saying, Dr. Scrimsher was saying about, if you're the sole caregiver for your child, if that's something that you're doing full time, then you would qualify?
Caregivers those who are providing are included now. So the best thing that you can do is try and get as many family members as fit into these phases vaccinated as soon as possible to help protect the child, since there is no vaccine for the child. But I do know caregivers have already been one of our different buckets, is what I call them, but different parts of that. Right, Brian? I know we did that, Brian. Tiffany?
Yeah, that was a new ad from the state that if you're a caregiver, whether paid or unpaid or licensed or unlicensed, if you're the dedicated caregiver for that person in your home, you do qualify now.
Great. Thank you for answering that. That's a question that I've received quite a bit from people. So thank you. Another question is related to misinformation and I think some of the myths that are circulating. And this person asks, that they have a family member who's anti-vaxxer of that type of thought. And so do we have any ideas around resources that people can be using, if they do want to take the time to have those one-on-one conversations with the people that they know, anywhere that we can point them to?
Yes, Megan answered and she pointed them to the Senior Resource Center and we're happy to help you. She put the number in and the option that they should press.
Great. And I'm just going to repeat that number for people listening that don't see the chat, people who may be watching the recording. Again, the number for the Senior Resource Center is 785-842-0543. And it looks like you can press 6 to leave a message and they will get back to you. So thank you for people being so gracious as to start answering these questions. I'm just looking through here. Okay, this is a question that we get quite a bit, so I want to go ahead and ask it to the panelists. How are people being notified for their second dose appointment?
So if they're getting their second dose through Heartland, we're sending out appointment reminder calls through our EHR via text and phone. I can't speak on LMH, so I'll ask Brian and then Kathy to speak on the health department. Are Brian and Kathy together?
We're here. Yeah, are we together yet? I don't know. We're blending. Go ahead, Brian.
So for LMH Health, we have joined with the health department. So we're now sending out a group of people to work at the health department. So I'll let Kathy speak to that. We will finish up phase 1, dose 2 clinics this week at LMH Health. So all those people have been scheduled. We will finish up phase 2, dose 2 next week, and all those people on that schedule. If you come in for your dose 1, we're scheduling you for a date and time for your dose 2. So you should know before you leave when your next dose is. And we don't have any more dose 1 clinics. So everyone that's receiving dose 2 should have that appointment. If you do not, you definitely want to call LMH scheduling line at 785-505-2424. I believe it's option 2 for phase 2. For the health department, I'll let Kathy speak to that. She's probably more educated on that than I am.
So with our process, we have in our medical records process, we have the ability to send out invitations or remind you for your first one. That's where it up until this point, it's been very important that you go back to where you got your first one. Things now will be mostly, after a bit, will be mostly between us and Heartland as far as sources, although the pharmacies are now starting to get some vaccines. And so they will also be reaching out or taking lists, whatever, and they will be responsible then to give you your second dose. The way the distribution of the vaccine works is when an agency receives a certain number of first doses or prime doses, then at the correct interval, they will receive that same number of booster doses. And so that's why we keep referring back to your original provider so that we don't give away vaccine here that was for someone that was at Heartland. It's just kind of that mathematic piece. But we are sending out reminders. If you know, I saw someone here, if you know that you got a vaccine through the health department out at the fairgrounds, and you have not yet been notified and you think you're due for your next shot, please contact us. We are running a second dose clinics. We're doing 2, Moderna in the morning and Pfizer in the afternoon. So if you have not gotten a reminder note, please call in so that we can get that straightened out and you can get an appointment for.
Health also sends a reminder out 72 hours and 3 hours prior to your follow-up appointment. So same thing with LMH. If you received your first dose at LMH, and if you've not received confirmation of your second dose, definitely reach out to us via that phone number I provided.
Thank you, each of you, for speaking more specifically to that process. I think that a lot of people, obviously, if they were interested in getting vaccinated the first time, that they do want to follow up and get that second dose. So I think that a lot of people here tonight would like to know that information. So thank you for sharing. We are getting close to time, and just to be mindful of our, especially our panelists and our moderators, you folks that are just, working hard right now on this event, I want to be mindful and make sure that we can wrap up in the next 5 minutes. So one of the questions that was asked that I'll just kind of quickly answer because it was already provided was, where people can find a list of the ingredients for both vaccines. Because people are, they're directed to not take the vaccine if they've had a previous allergic reaction or are allergic to the ingredients, but they may not necessarily know where to find those ingredient list. And it looks like Dr. Scrimshire, thank you. She shared a link to the CDC website. So if you're just listening by, or if you're here by phone and you do not see the chat, it looks like you could go to CDC's website and try to search for it there. But if you are here and you do see the chat, you can go in the chat. It's not that far from more recent chats that were sent, and you can see that link. But very good question. And then
Alex, I want to clarify one here because I don't want to create confusion on my comments around phase 2. A question said that did Brian just say that they'll be done with phase 2 dose 1 after the clinic tomorrow? And that is correct. We'll be done with phase 2 dose 1 clinics at LMH. We're not done with phase 2. It's just that LMH will be joining forces with the county health department, and we'll be doing all of our vaccination clinics in coordination with that group. So we'll be going from roughly a 1,200 a day clinic out at the fairgrounds to over 2,000 because we're going to take our vaccination clinic out to that site to try to centralize it and make it more streamlined.
Thank you, Brian. And it looks like people are beginning to answer the question about phase 2 regarding farmers, agriculture workers. I knew that I received a email vicariously through Porter from Janet. Thank you, Janet, for your question. And I had actually done a little bit of research and it looked like that they counted, but it looks like we're giving you some more information here. Yeah, could anybody speak to that definitively if farmers count for phase 2?
Yes, I have my.
And we can feel free to take our time on this too.
It's all right, Alex. I'm pulling up my my sheets, our little guidelines here. So agricultural work in the following industries, and as Dr. Scrimshire has noted, it also has to do with, where did you put that? Is considered critical, but a caveat. Workers in the following industries, if they regularly need to be in high-risk settings to perform their duties. So there is a bit of a caveat there as far as being an agricultural worker.
Yeah, and screen sharing really quickly here. I do have the phases pulled up. And so what Kathy's talking about here in the phase 2 is that really phase 2 and 3, we're looking at quite a few different kinds of critical workers. Phase 2, of course, we are elevating those at the high contact level, folks who are regularly in contact with many individuals versus other critical workers who may have slightly less risk in their jobs. But it sounds like that maybe farmers count for both phase 2 and 3 based on if they're high risk or not high risk.
That is correct.
Okay. Thanks for clarifying that, because I felt bad having Janet was in my inbox and I did not have a concrete answer for her. So thank you so much. I am going to go ahead and wrap up the event with a few housekeeping, a few closing thanks and reminders, and then I definitely want to pass it over to, it looks like Megan's still here, Megan, to repeat herself a little bit about some of the Senior Resource Center stuff. And so you can hang on if you're interested in that, because I think that's great material and we want to get that information out to people. But I would like to thank our panelists. Thank you, Brian, Kathy, Rua, Dr. Scrimshire, and Tiffany for your time and your expertise tonight. Especially Dr. Scrimshire, I know I asked you quite a few questions right off the bat to open up this panel. And so thank you. And thank you those of you that have been so great by going through the chat and really answering a lot of those questions. I am going to go ahead and save the chat. And if others here are interested in saving chat, there's a little 3-dot button. There's a button with 3 dots on it in the upper right of just the chat panel where you would normally type in what you're going to send. And you can click on that to save the chat if there was phone numbers shared in the chat or things like that that you would like to save. also copying and pasting if you're that tech savvy. So thank you so much for all of you, not only your help here on the panel, but now also in the chat, which is additional labor that you did not have to do last time. So I thank you for that. Thank you so much to Porter R. Neal in the City of Lawrence. City Hall was open for people that needed in-person accommodations tonight, and so that's why Porter is there. He's probably there for other reasons too, but part of it was that accommodations factor. And then thanks so much to Kurt Henning as well, who's handling our wonderful video for tonight. He's so skilled at what he does. And let's see here. Oh, thank you also to Unified Command. This event was brought to you by Unified Command, but specifically the branches involved have been the Equity Impact Advisors, the PIOs, who are our communications people, the Surveillance Testing Unit, and the Vaccination Unit. And so those are the 4 branches of that structure that we showed you that have put a lot of labor towards planning these and promoting these for you all to be able to see it and come in and attend. And like I said a little bit before, we are trying to plan some follow-up with everybody. We do have your email addresses because you registered to come to tonight's event. And so we're hoping to be able to follow up with people on some of the questions that we didn't get to, or clarification on questions, or even if between now and a few weeks from now when we're sending that, if answers to some of these questions have changed, we want to clarify that for you. And so definitely look out for, we promise not to like completely bombard you with emails, we're not going to spam you too much, but in regards to the topics discussed tonight, in knowing that you're interested in them, we may send you some follow-up information. Is there anything that my panelists would like to say or clarify, or something else that you would like to add to what you've already said?
You guys know I always have to say, like, please, please, please give us grace through this pandemic. Know that things are still changing second by second, minute by minute. This team is committed to making sure that you have the information. We are all working extra hard to get it to you. It may not be as fast as you like, but we are committed to this community. So please, please, please understand that things change. As right now, we are at the mercy of what the state tells us to do. And as we know, you all will know. And we are committed to making sure that you get the right answers in the right amount of time that we can give them to you.
Thank you, Tiffany. Great message. Any of our other panelists have anything to add?
Just a big thank you to Alex for hosting again for the panel, and a lot of good questions. Hopefully this answered some of them. There's probably some more to come, but thanks for everyone's interest in being involved in the community.
Thank you. It's really fun hosting you all.
Thank you for having us. I appreciate the time that we were able to provide those answers.
Thanks to everyone for your time, and thank you, Alex. Glad to be a part of this.
Thank you. I think with that, I'd like to thank our audience for coming tonight. We really appreciate that you trust us and want to engage with us and spend your time with us to get some answers to your questions. We appreciate your questions. Your questions, whether we answered them or not, are definitely influential in our planning and operations. So your questions are not just disappearing into a vacuum. These are things that we may have already been thinking about, that we know material is going to come out soon, or questions that we hopefully will loop back to you on these follow-up email that we're talking about, where we can help answer some questions that maybe we didn't get to. But to close us out, I want to pop it over to Megan Poindexter to share again about the Senior Resource Center, since we have quite a few people on the call that may be interested in that, and also some people who may have joined us late coming into this panel event. And then also, Rua, if you have anything to share about testing again, I know that there's some events happening this week. So I'll do it to Megan and then Rua. And this is closing us out, by the way. So stay if you're interested in this information, and we will get in touch with you for any future events.
Thank you, Alex. So to reiterate, the Senior Resource Center has been just working really hard to assist those who are digital tourists, as I've decided to refer to it, to be those personal tour guides through this process. And so if you or someone that you know is struggling with access to a computer or difficulty just navigating the process, the digital process, doesn't have internet access, or is just feeling frustrated and needs to have someone to kind of talk through what they're frustrated with or concerned about, please don't hesitate to give us a call. The number is 785-842-0543. If you press 6, that'll take you to Jerry's voicemail box. And Jerry will, he basically will triage your message to one of the staff or volunteers who are calling people back. We're typically able to call folks back within 12 hours or so, usually within about a day's time, we're able to call folks back. So don't hesitate to let us know. We can look you up on the list of the survey list. If you're struggling to figure out why your name isn't showing up when you do the search, we can help work through that. We're just really happy to do whatever we can, and don't hesitate to reach out.
Thank you, Megan. And for me, I just went ahead and put it in the chat, but just a reminder that this Saturday from 10 a.m. to 4 p.m., we will be handing out tests that folks can take home. You may drop off this test at any FedEx site, or we'll also have a container with us at the Merck if you wanted to just collect the sample nearby and drop it off. So that is going to be at the Merck on Saturday.
Thanks to you both for the great work that you're doing. I'm proud and honored to work with you both, and probably a few different groups at this point. I think that we're spread across a few different groups. So thank you so much for sharing. Thank you so much again to the panelists, moderators, our audience. We care about our community very much, and we are honored to work for you. So have a good rest of your night.